Every day, we get new information on the spread of COVID-19 in Arkansas and how the state will move forward. We know a lot of you have questions, and to help us answer those for you, we welcome once again Dr. Gary Berner from the Community Clinic of Northwest Arkansas. Dr. Berner, we appreciate your time. A big topic right now is the reopening of some businesses in Arkansas. Many people have reached out to me expressing concern about this. Should people be fearful right now?
I think that's a great question and a good topic to cover because I certainly appreciate the concern, and I think that's understandable and appropriate to have some level of concern. I really wouldn't want our Northwest Arkansans to have that fear, though. I think if we can move forward with kind of an educated precaution, follow what's happening on this news station, check in with Arkansas Department of Health.
Well, we know that gyms are now able to reopen. What can we do to protect our health and safety as we begin to get out and really surround ourselves with more people?
So I think moving forward and trying to continue those social distancing lessons that we've learned over the past couple months. As much as possible. And so just being aware of what your hands are touching, and then having a little bit, increased level of precaution. If you're entering into a gym or a restaurant that you just don't feel comfortable with, that you feel like feels a little overcrowded, take that as a sign. Listen to your gut and your intuition that, maybe we'll pause and we'll come back when things are a little bit quieter.
Yeah, well, a lot of businesses and companies are stressing the importance of wearing face masks right now. We've talked about this with you before, but why are we seeing this become more of a mandated type of thing right now? And then what exactly do face masks do for us?
I think masks are becoming more requested, more recommended, and even potentially mandated because they do help. But really think about them more helping in prevention of the spread, less in a help about protecting you from the virus. So a big part of us wearing is really being respectful to our coworkers, to our neighbors, to the people that we might pass on the bike trail.
We've been in this pandemic for several weeks now. I know you have been studying this very closely. As of late, is there anything new you've learned about prevention?
I don't think there's really been any huge breakthroughs in prevention. A big part of really what we've been following, stuff pops up here and there, rumors and ideas pop up here and there. I think if I could really highlight, though, it would just be, education and awareness of yourself, of your hands. I'd really say that those are the big pieces in prevention, is if you understand what you can do to protect yourself and your family, you're going to be a lot better off.
What about progress made in testing? Is there anything new on that end?
There is quite a few updates in testing. The number one update is that we're getting more testing, and so they're more widely available, which means that we can, test more people and localize who has it, and then they can get quarantined and isolated. But number two would be they're getting faster, and so initially it was taking 14 days, then it got down to 4 to 6 days, and a lot of times tests are coming back in, roughly a day now.
Yeah, well, speaking of testing, I know there's been a lot of talk about antibody testing. What do we know about this kind of testing, and how does it help medical professionals like yourself?
So antibody tests, they detect the presence of an antibody in your going through your blood system. They do not detect the virus. They do not prove immunity. They can tell us that you're likely immune, that you likely had the coronavirus at some point, but they can't tell whether that was 1 week ago or 6 weeks ago. That test is improving, and there's offering more options, but there's a lot of kind of caveats and unique things about it.
Well, moving forward, as we begin to return to some sort of a norm, what do you hope people remember?
I think the really takeaway would be things that are non-medical, that are really not my field of expertise, but just a general act of kindness. I really don't think people are going to remember how well they did at stocking up on toilet paper. I certainly think that they'll remember the time that their neighbor, spared a square and gave them a roll.
Yeah.
I think the food banks are remembering the donations that they're given, and the healthcare workers that a friend brought them over dinner. I certainly have remembered that.
Absolutely. Dr. Berner, those are all the questions we have. As always, we appreciate your commitment to keeping our viewers informed.